Yeah, thank you for inviting me to share some recent work that our group has performed. And this is a true group effort. I appreciate this opportunity to talk to you about it. Setting the stage is this diagram that shows the age-adjusted rate of drug overdose deaths involving opioids in the US. And what you see here over time, there's a notable increase. And this increase is driven mostly by, here shown in blue, synthetic opioids. And this is where fentanyl falls as a synthetic opioid. In contrast, heroin, for example, is not causing as many deaths over time. So this sets the stage for patients we saw in clinic. This is a patient who was seen by our team in August 2022. He came to us for a number of physical differences, including a club foot. There were some concerns about his relatively low birth weight and birth length. The pregnancy was complicated by use of fentanyl and other drugs throughout the pregnancy, and the patient was in the hospital for 6 weeks due to neonatal abstinence syndrome. When we saw him, in addition to the really distinctive facial features that you might appreciate with the short nasal tip, the really small chin, we also knew about the talipes equinovarus. The patient had in both hands a single palmar crease, which to us is a distinctive finding. So he had a number of physical findings that led us to think he might have an underlying condition, but genetic testing did not identify any specific diagnosis in him. So we could not identify a genetic cause for his findings. Now, interestingly, this patient looked a lot like another patient that was followed in our cleft and craniofacial clinic. This patient had come to attention around the same time. He was also the product of a pregnancy that included polysubstance abuse, including fentanyl. He was also relatively small at birth, had neonatal abstinence syndrome. You see the very similar facial features with the incredibly short nasal tip, the long philtrum, the really small chin. He also has a single palmar crease, and he has mild tooth syndactyly that's shown here. So this patient had a cleft palate, but not a cleft lip. And in the cleft clinic at Nemours, there were a number of other patients shown here who had very similar findings of cleft palate, but not a cleft lip, of a single palmar crease, as you see here, tooth syndactyly. In boys, there were some subtle genital abnormalities. Several of the patients had foot position abnormalities. So there was a clear overlap of findings in these patients. They shared a lot of features. And in none of these patients were we able to make a specific genetic diagnosis. However, they all had a notable exposure to fentanyl throughout their pregnancy in the context of a maternal opioid use disorder. So we asked ourselves if we had possibly identified a new syndrome. We were also puzzled by the fact that these patients all showed a lot of findings that made us first think of a condition called Smith-Lemli-Opitz syndrome. And I will show you a little bit more about this condition in the next few slides. However, we could not confirm a diagnosis of either Smith-Lemli-Opitz syndrome or another condition through detailed genetic testing. So we were wondering if possibly the prenatal fentanyl exposure was driving this phenotype. And we obtained an IRB-approved protocol in order to study this in more detail. Now, I mentioned Smith-Lemli-Opitz syndrome. This is a genetic condition, an autosomal recessive disorder that's caused by loss of function in the DE-CTR gene. This gene is an enzyme that is very important in cholesterol metabolism. So shown here is a very simplified diagram of cholesterol biosynthesis. Here's the enzyme that is deficient in Smith-Lemli-Opitz syndrome. and you can produce cholesterol using this pathway. I want to draw your attention here to aldosterone. We're going to circle back to that later. So in Smith-Lemli-Opitz syndrome, what you see is low cholesterol level in blood and elevated 7 and 8 dehydrocholesterol levels. Those are hallmarks of Smith-Lemli-Opitz syndrome. Cholesterol is very, very important in embryogenesis for many reasons, skipping over the details in the interest of time. These here are patients who have Smith-Lemli-Opitz syndrome, so they have a genetic condition that impairs cholesterol biosynthesis. They have intrauterine growth restriction. They show small head size, short stature, failure to thrive, and distinctive facial features with a really bitemporal narrowing, as you can see here, somewhat widely spaced eyes, ptosis of the eyelids that you see here. They can have epicanthal folds, as you see here, and a short nasal tip, as you saw in the other patients' pictures that I've shown you. They can also have a cleft palate and a small jaw. There are many other hallmarks of Smith-Lemli-Opitz syndrome, in particular the 2-3 syndactyly of toes. And we see that in a patient always makes us think of this condition. There are a number of other physical features that we can't see in Smith-Lemli-Opitz syndrome. And when we compare the features of Smith-Lemli-Opitz syndrome and what we saw in the babies that had the fentanyl exposure in pregnancy, we see a lot of similarities, including the small size, short stature, cleft palate, ptosis of the eyes, the short nose, a short adducted thumb, the 2-3 syndactyly, some GU anomalies in the males, and so on. Here again are comparisons of the facial features patients with Smith-Lemli-Opitz syndrome compared to our patients who had the fentanyl exposure in pregnancy. And I think you can appreciate some of the similarities with the ptosis, that's the droopy eyelids, the short nasal tip, the small jaw. So there are a lot of shared facial features, and there are shared other findings. I'm stressing here the 2-3 syndactyly that is so characteristic for Smith-Lemli-Opitz syndrome that we also see in our patients, the single palmar crease, and the somewhat short and adducted thumbs seen in Smith-Lemli-Opitz syndrome and in our patients. So we were wondering why the patients that we were looking at had so many findings that reminded us of Smith-Lemli-Opitz syndrome. And we were wondering if fentanyl could affect the cholesterol synthesis during pregnancy, and for that reason affect cholesterol metabolism and lead to very similar findings compared to Smith-Lemli-Opitz syndrome. Interestingly, there is some precedent that there are drugs that can disrupt cholesterol metabolism. And this is work that was done by the Corrado lab that showed that indeed there are medications that can affect steroid biosynthesis. So we wanted to review if indeed we had identified a novel syndrome, and we needed to review the evidence for that. We were able to use the patient's facial photographs and use a deep convolutional neural network analysis to assess the facial features. This here is a diagram of how we use this approach in clinic. We can take a patient's photograph. The deep convolutional neural network analysis compares the patient's features to features that the system has already been trained on. So these patients' photographs can be compared to syndromes that the system already knows and has information on. Now, this wasn't helpful for our patients because we were wondering if these patients might have a novel syndrome. So we needed to use a slightly different approach. We used the same system, but instead of comparing the images to predefined and pre-studied syndromes, we used an approach where each image can be compared to each other image. And using this approach, we were able to show, here's a 3D representation of this, that the patients with a novel syndrome shown here with the red crosses are more similar to each other compared to other control populations. We use patients with Smith-Lemli-Opitz syndrome. Those are the orange blocks. In green, fetal alcohol syndrome, and typical individuals in blue. So using this approach, we were able to perform statistical analysis, and we were able to show already with a small patient cohort that the facial features of our patients are more similar to each other than to these other control groups, and that indeed this facial phenotype suggests a novel syndrome that is statistically significantly different from the other groups that we compared the facial photographs to. This here is a composite of the 6 patient images that we used for our analysis. And when we looked at our patients, I've already told you a lot about them. In addition, we found that our patients, when they were first born, showed some abnormalities of cholesterol metabolism on blood testing. Specifically, they had elevated 7 and 8 dehydrocholesterol. But when they were tested again a few months later, this abnormality had resolved. So again, a very peculiar finding. We were able to present the data, and we were then able to add 4 additional patients to our original cohort of 6. In these patients, you see they are male and female. They share similar findings with a short nasal tip, a thin upper lip. 7 had a cleft palate, the small jaw, single palmar crease with a slightly broad adducted thumb. Many had foot position abnormalities. The tooth syndactyly was seen in 8, some genital anomalies in males. And those who were tested early on showed some abnormalities of cholesterol metabolism, specifically the elevated 7 and 8 dehydrocholesterol, but none of these patients were ultimately diagnosed with a genetic condition. So when we look at what do we know about prenatal opioid exposure, we do know that some meta-analyses have shown that this could result in oral clefts, cardiac defects, and talipes equinovarus or clubfoot. But I have to mention that this is not found in every single study. We also already know that fentanyl is very effectively transferred to the fetus in early pregnancy. So if we want to postulate that fentanyl might be driving this phenotype, it is definitely necessary that it does get transferred to the fetus in early pregnancy, and we do know that that's the case. Many studies on opioid exposure and pregnancy were performed using opioids other than fentanyl. Fentanyl is a relatively newer, very potent opioid that is not available in many databases or in many pharmacies that are used for animal studies. So fentanyl has not been studied in as much detail as other opioids. But we do already know that some psychotropic drugs can affect cholesterol metabolism. I mentioned the Corrado study to you before. So when we want to assess if a drug acts as a teratogen in humans, we turn to the Bradford Hill and Shepard criteria. These were proposed in 1965 and 1994. And most recently, these were used when Dr. Sonja Rasmussen looked at birth defects caused by Zika virus infection during pregnancy. So these criteria are still what we use when we have a question about teratogenicity in humans. And when we looked at the Bradford Hill criteria, applying them to this potentially novel syndrome due to fentanyl exposure, we see that we meet some, but not all of those criteria. And there is not a certain threshold that one has to meet in order to consider this meaningful. For the Shepard criteria, again, we already met some, but not all of the criteria. And in order to be considered meaningful, one has to either meet the first 3, which we didn't at that point, or criteria 1, 3, and 4, which we already met at this early stage. So we had some evidence that this indeed was due to fentanyl teratogenicity. The Shepard and Bradford Hill criteria were not inconsistent with this being fetal fentanyl syndrome. However, we also couldn't rule out that there was another substance or contaminant, for example, in the drugs that was causing this phenotype. Clearly, confirmation was necessary and would be great to have prospective studies documenting fentanyl exposure and the outcome. And we needed laboratory studies to prove what we were saying, that indeed fentanyl does affect the cholesterol metabolism. And ideally, we would need animal studies to recapitulate the phenotype. But we were able at this point to publish our work. And if anyone wants to look at this in more detail, please look also at the supplemental files. That's where most of the details are located. So we needed to study fentanyl's effect on the cholesterol metabolism. And we were really lucky to partner up with the Colorado lab in Nebraska that has done this work for many years. They performed in vitro studies looking at fentanyl's effect on cholesterol synthesis. They used a mouse neuronal cell line, developing mouse astrocytes and neurons, as well as human dermal fibroblasts. And these human fibroblasts were either from typical individuals or from parents of a child with Smith-Lemli-Opitz syndrome. So this was a parent who had one of their 70HCR genes not functioning. So when we look at the results, what we see here, this is showing the effect on neurons. And I just want to draw your attention to the 7 and 8 dehydrocholesterol measurements. With increasing fentanyl exposure, you have a notable increase in the 7 and the 8 dehydrocholesterol, and you have a decrease in cholesterol synthesis. So shown here is the effect that fentanyl has on cholesterol metabolism. Similar findings here on the human fibroblasts. These here are fibroblasts from parents of a child with Smith-Lemli-Opitz syndrome. These are from typical individuals. And you see that increasing fentanyl exposure increases the 7-dehydrocholesterol more so in the parent of a child with Smith-Lemli-Opitz syndrome compared to a typical individual. And here is the same experiment with cells from different individuals, same effect. So again, you see the effect that fentanyl has on the cholesterol metabolism. And shown here is a much more complicated pathway. I showed you lanosterol before, where lanosterol went straight to the cholesterol. Here you see in more detail the cholesterol metabolism. And shown here is that fentanyl affects many steps of the cholesterol biosynthesis. So really proving the point that fentanyl has a direct effect on the cholesterol biosynthesis. So we can now say that indeed this is fetal fentanyl syndrome, that we recognized a novel embryopathy that is associated with prenatal fentanyl use in the context of an opioid use disorder. So I want to stress this again. This is daily high-dose use of fentanyl. This is not fentanyl use in the context of one medical procedure during a pregnancy. We now know that fentanyl is a multi-enzyme inhibitor of cholesterol biosynthesis in developing neurons and astrocytes. And for this particular phenotype in patients, we have a biomarker. When you look at these neonates really early on, you can find the elevated 7 and 8 dehydrocholesterol in their blood. So that would be a reflection of the abnormality of the cholesterol synthesis defect during pregnancy. So this is, I think, really unique that you have a biomarker for an embryopathy that's caused by a teratogen. Obviously, we need a lot more information and more follow-up. And this was true teamwork. This is our Nemours team with Aaron Wadman, Candice Mas, Erica Fernandez, and myself. And this is the team from the Colorado lab in Nebraska. So thank you. I'm happy to take your questions.